Hey guys, welcome back. Today we'll be learning the next chapter, chapter number 10, which is respiratory system. I'm so excited to teach this respiratory system because this is one of the most frequent conditions which you will be observing in your documentation. If you are coding any chart, most of the charts may have the codes from this category, from this chapter. The code series starts with J, alphabet J. Here we'll see all the conditions or all the guidelines which we have in respiratory system. Here the major guidelines were COPD, asthma, respiratory failure and pneumonia. We'll go step by step. What are the guidelines for COPD, what are the guidelines for pneumonia, what are the guidelines for respiratory failure, and what are the guidelines for any influenza. Let's see. Let's start. First one would be COPD. If we have a documentation of COPD, we'll be going with COPD code. But if we have a documentation of COPD with asthma, we have to be little more cautious on it. Please focus, because we have some different guideline for it. Let's take an example. If a patient has COPD, acute COPD as well as asthma, acute COPD as well as asthma, in this scenario, how many codes you will be coding? Just guess, 1 or 2. Acute COPD as well as asthma, how many codes? 1 or 2, 1 or 2. If your answer is 2, then that is wrong. We will be coding one code. We will be coding one code. And let me give another example. Patient has acute COPD as well as acute asthma. In this scenario, how many codes you will be coding? 1 or 2, 1 or 2. If your answer is 2, then you're right, because in previous example, just asthma, which is a part of COPD as per one of the coding clinic. But in second scenario, we have acute COPD as well as acute asthma. Acute COPD doesn't have a clear picture or identification stating that acute asthma. That's the reason we'll be giving 2 codes in order to show, or in order to tell the physician, or in order to tell the biller, in order to tell whoever it might be, the chart who are reviewing, it gives a clear picture. Yes, patient has COPD as well as asthma. That's the reason we need to mainly focus on the guidelines which we have. As I mentioned, the series starts with J, right? What is the code for COPD? Do you have that question? It will be roughly around J44 series. If you want to code only COPD with XYZ, go with J44 series. If you want to code any asthma, go with J45 series. This is how you need to look. You need to remember codes afterwards. You need to just remember the series. Don't by heart or mug up the codes. It will not work. It will not work, because we have tools which easily guides you. You need to learn how to apply the guidelines, not how to remember the codes. Don't remember the codes. Just follow the guidelines. Follow the instructions from alphabetical. Follow the instructions from tabular list. Then definitely you will be succeeded one day. That's for sure. Let's come back to the topic. We have discussed about COPD and acute COPD and asthma. Acute COPD as well as acute asthma. Fine. Now, if we have a documentation like this, acute COPD as well as pneumonia, acute COPD as well as pneumonia, in this scenario, how many codes you will be coding? 1 or 2? If your answer is 2, yes, you're right. We'll be coding COPD as well as pneumonia. But wait a minute. We have a guideline. We have a combination code. Normal COPD is different. Normal COPD, it will be somewhere COPD unspecified or acute COPD like that. But in pneumonia kind of scenarios, we have acute COPD with lower respiratory infection. With lower respiratory infection. The code itself states that lower infection. That means some other infection is there, like pneumonia or acute bronchitis. Both the things were covered in this lower infection. Remember, whenever you have a documentation of COPD as well as pneumonia, or COPD as well as acute bronchitis, we will be coding 2 conditions. But for COPD, we have a combination with lower infection. Remember that, with lower infection. The series is same, but the code description is different. You need to remember this point in COPD, asthma, pneumonia, as well as acute bronchitis. Let me give quick overview of COPD. If we have multiple types or organisms of pneumonia, code multiple organisms, but COPD with lower infection. And what would be your PDX? In first scenario, when we have an acute COPD as well as acute asthma, the focus of treatment, we can go with any condition. We can refer that guideline which we had discussed in selection of principal diagnosis. If both the conditions were treated equally, any condition should be a principal diagnosis. Note, we have 4 points, right? 1, 2, 3, 4 guidelines. We need to remember official, all those things we have, right? Go to that video and look what are the guidelines we have. You need to look that. If we don't have anything, we can go with any one condition. But here, COPD with lower infection we are coding. In this case, COPD lower infection should be a principal diagnosis followed by pneumonia. Unless until if we have any other kind of pneumonia mainly focused, then pneumonia should be a principal diagnosis. This is how you need to code COPD conditions. Next, we'll be discussing about respiratory failure in coming video. Stay tuned.